Some research shows that kids and teens who have access to gender-affirming care have better mental health and overall well-being than those who don't. Have you heard about this? Well, some experts call it a medical necessity. Others believe children should not be allowed to have these gender surgeries. Case in point, a court in Alabama just ruled against it. In an 11-4 decision, a federal appeals court upheld a ruling allowing the state to enforce a ban on treating minors with puberty blockers or hormones. The law enacted in 2022 makes it a felony to treat transgender individuals under the age of 19. Violations could result up to 10 years in prison. The debate over transgender care stretches far beyond Alabama. 25 states currently have laws that limit or ban gender-affirming care for minors. The Supreme Court is set to hear a case out of Tennessee next term on whether state bans are constitutional. And it's not just parents and politicians who are divided on this. NewsNation sat down exclusively with the head of the American Society of Plastic Surgeons, who's breaking from other major professional medical organizations when it comes to gender-affirming care. Such an interesting topic, and NewsNation investigative correspondent Rich McHugh spoke with the doctor and joins us now with more on this. Rich, what did you learn?
Hi, Laura. Well, listen, we've been reporting on this topic, gender-affirming care for minors, for 3 years. And in that time, we've asked each of the heads of these major medical groups to sit down with us. None of them have. Finally, one of them did, the head of the plastic surgeons. And what he said is a big deal, that the evidence base for these surgeries is low. Take a look.
It's one of the most divisive issues in America right now, gender-affirming care for minors. And the justification for it has been all the major U.S. medical groups support it. But that is no longer the case.
The American Society of Plastic Surgeons' position is right now there isn't great data supporting gender-affirming care in adolescents.
Dr. Stephen Williams, president of the American Society of Plastic Surgeons, says there is considerable uncertainty as to the long-term efficacy for these surgeries and that the existing evidence base is viewed as low quality.
As a plastic surgeon, if a 13-year-old came to you and said, I want to have a double mastectomy,
I'd prefer gender-affirming care in adolescents. And the reason why is because I don't think the data supports it. And so my practice, we don't even entertain that.
You personally don't?
I personally do not.
Because the data doesn't support it?
Because the data doesn't support it, and also because I think that the navigating some of the parental-child interactions and trying to figure out motivations for care and that overall social milieu that definitely affects adolescents, I find it incredibly complicated. And as a physician, it's important that you're able to perform care that you're confident in.
Dr. Sheila Nazarian, a Beverly Hills plastic surgeon and member of the ASPS, takes it further. She says political capture is part of the issue.
This is 100% in America a political issue, whereas if we look in Europe, very progressive governments have backed off of these procedures in minors because they're just analyzing the data, as we should with every procedure, every medication, every medical pursuit that we undertake. We should be looking at data, not just in the US, but from our colleagues. We do that for every other type of procedure.
One hurdle to productive research, she says, is the partisan divide over youth gender medicine here in America.
Protecting and supporting access to gender-affirming health care is essential to being a welcoming and supportive state to the community.
The left-wing gender insanity being pushed on our children is an act of child abuse.
Donald Trump has recently said that if he is elected, he's going to make it a felony for any surgeon who provides these surgeries without parental consent. So if he institutes that, if he makes it a crime, how will you advise your organization?
If Donald Trump came out and said, I'm going to make it a crime for women to get breast reconstruction, then we would have very good evidence to support that statements like that are harmful to patients. Currently, we don't have the data. My guess is if this were to be criminalized, this would be something that would spur additional research to potentially support the benefits or maybe to prove that there aren't benefits for this.
Is there any part of this that keeps you up at night?
All of it. I lose sleep over it because the one part that's definitely not quite there yet is we need better data when it comes to adolescent gender-affirming care. we need to do more work here. It's not clear that these surgeries in adolescents are the right thing. It's not clear that we fully understand the consequences. It's not fully clear that we're doing them at the right time in the right way. And so until there's more data on that, I think everyone's concerned on all sides.
Now, Dr. Williams says he hopes that this will prompt the other major medical groups to have a transparent discussion about this. I do want to note, Laura, that we have an open invitation to all of them if they ever want to sit down and talk about this.
Rich McHugh, I was just going to say, I know that you're after those other people, and we'll hopefully hear from them as well. Thank you so much for that report. Excellent.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.